If you are waking up at night again and again to urinate, if your urine stream feels weak or slow, or if going to the bathroom has started controlling your daily life, you are not alone. These are common signs of prostate enlargement, and they worry many men. The good news is this: effective medicines do exist. But the best medicine is not the same for everyone. Today, I will clearly explain which prostate medicines actually work, how they work, and which one is right for you. As a urologist, I see men with prostate problems every single day. Some come scared, some come frustrated. Many have already tried medicines they found online or heard about from friends. In real urology practice, one thing becomes very clear very quickly: prostate enlargement is not the same for every man. Two patients can have the same age, but completely different symptoms and completely different responses to medicine. That is why there is so much confusion. One medicine helps one patient feel normal again, while another patient feels no improvement at all. This is not because the medicine is bad. It is because the choice was wrong for that body. My goal here is not to promote one drug. My goal is to help you understand why doctors choose certain medicines and who actually benefits from them. Once you understand this logic, prostate treatment stops feeling confusing and starts making sense. The prostate is a small gland that sits just below the bladder. The urine tube passes directly through it. As men age, this gland often starts to grow. This condition is called benign prostate enlargement, or BPH. Benign means it is not cancer. But benign does not mean harmless. When the prostate grows, it presses on the urine tube like a hand squeezing a straw. Urine flow becomes weak. It takes longer to start urinating. The bladder never feels fully empty. At night, the bladder wakes you up again and again. Many men think this is just normal aging. It is not. These symptoms slowly steal sleep, confidence, and daily comfort. Some men plan their lives around bathrooms without realizing it. BPH is extremely common, but it should never be ignored. Here is the shocking truth most patients never hear. There is no single best medicine for prostate enlargement. Anyone telling you otherwise is oversimplifying a medical condition. The right treatment depends on several factors. Prostate size matters. A small prostate behaves very differently from a large one. Symptom severity matters. Mild symptoms need a very different approach than severe blockage. Age plays a role. So does your tolerance for side effects. Some men want fast relief. Others are willing to wait for long-term improvement. This is why copying someone else's prescription often fails. Prostate treatment is not about trends. It is about matching the medicine to your prostate and your symptoms. The most commonly prescribed medicines are called alpha blockers. These medicines do not shrink the prostate. Instead, they relax the muscles around the prostate and bladder neck. When these muscles relax, urine can flow more easily. That is why many patients feel improvement within days. The urine stream becomes stronger. Nighttime bathroom visits reduce. Life feels normal again quickly. Common examples include Tamsulosin and Alfuzosin. These medicines are usually the first choice when symptoms are bothersome but the prostate is not very large. They are effective, widely used, and well studied. But they are not perfect for everyone. They treat symptoms, not the root cause. In urology practice, one medicine is prescribed more than almost any other for prostate enlargement, and that is Tamsulosin. Tamsulosin belongs to a group of drugs called alpha blockers. It does not shrink the prostate. Instead, it relaxes the muscles inside the prostate and at the opening of the bladder. When these muscles relax, urine can flow more freely. That is why many patients notice improvement within just a few days. The urine stream becomes stronger. Nighttime bathroom visits reduce. Daily life feels easier again. However, there is an important point many patients do not realize. Tamsulosin treats symptoms, not the root cause. If the prostate is significantly enlarged, Tamsulosin alone may not be enough. This is why it works extremely well for the right patient, but it is not the best choice for everyone. Another group of medicines works very differently. These drugs actually shrink the prostate over time. They block hormones that cause prostate growth. Because of this, they work slowly. Improvement may take months, not days. But for men with a larger prostate, these medicines can be life-changing. They reduce blockage, lower the risk of urinary retention, and can delay or prevent surgery. Common examples include finasteride and dutasteride. These medicines are not meant for quick relief. They are for long-term control. This difference is critical, yet many patients are never told this. Some men need more than one medicine. In urology, combination therapy is often used when symptoms are severe or the prostate is clearly large. One medicine provides fast symptom relief. The other works silently in the background, shrinking the prostate over time. This is not guesswork. Large clinical studies support this approach. Patients on combination therapy often do better than those on a single drug. But combination therapy is also where side effects must be watched carefully. This is why follow-up matters. If symptoms are mild and the prostate is small, alpha blockers are often enough. If the prostate is large, shrinking medicines become important. If symptoms are severe and quality of life is poor, combination therapy may be the best option. The best medicine is not about popularity. It is about matching the treatment to the problem. This personalized approach is the foundation of good urology care. Every medicine has side effects. Alpha blockers can cause dizziness or low blood pressure, especially when standing up quickly. Some men notice changes in ejaculation. Prostate shrinking medicines can affect libido in a small percentage of patients. These effects are real, but for many men, the benefits outweigh the risks. What matters is knowing what to expect and reporting problems early. Medicine is not always the final answer. If urine retention develops, if infections repeat, or if bladder damage begins, procedures or surgery may be needed. Ignoring warning signs can lead to permanent bladder problems. This is why monitoring is just as important as treatment. Do not self-medicate. Do not stop your medicine suddenly. And never assume one pill works for everyone. A proper evaluation makes all the difference. Talk to a urologist before choosing or changing treatment. Prostate enlargement is common, but suffering is not normal. With the right medicine, chosen for the right reason, most men can regain comfort and control. Informed decisions lead to better outcomes and better lives.